in the hospitals is not that high. What does that really mean? Let's ask our experts. And I say good evening to Mr. Rajiv Dasgupta, Chairman of the Center of Social Medicine and Community Health at JNU, Dr. Om Shrivastav, Director for Infectious Diseases at Jaslok Hospital and Research Center. He's a member of the COVID Task Force in Maharashtra. Dr. T.P. Lahane, Director of the Medical Education and Research in Maharashtra. And Dr. Subhash Salunke, Senior Advisor for Public Health Foundation of India and a member of the COVID-19 Task Force. Let me go across to first up Dr. T.P. Lahane. Dr. Lahane, help us understand, why is it that Maharashtra is seeing so many cases when rest of the country isn't? I mean, if it is about COVID inappropriate behavior, I don't think in other parts of the country people are any more disciplined.
I think the number of the cases what we are increasing Maharashtra, it is one cause is definitely COVID appropriate behavior. The second cause, if you see, up till now, whenever there is a, you can say the epidemic has happened, and in that epidemic, the western zone of the country is always get more affected as a geographical thing. And I think in Maharashtra also, I think there is a geographical distribution. Because of that, the number of the cases are more, and it is not related to any new strain or like that. But yes, the crowding is definitely there. It is not only in Maharashtra but outside Maharashtra also. But I think it is the geographical distribution of the epidemic disease, and that may be the one of the cause where the number of the cases in Maharashtra are increasing. And we are really worried that we are taking all precautions. We are doing the testing. We are doing the tracing. We are also now there is a night curfew, then also the lockdown. But it is said that the second time lockdown is not most effective. But it is to, I think, aware the people that they should now go for the COVID appropriate behavior, so the number of the cases will decrease.
Yes, in fact, that I agree with you, and it's more about the messaging as of now. We've been trying to do that for the last 15-20 days with night curfews, then weekend lockdowns. It's to remind people that, if we don't pull up our socks and get our act together right now, then things could get really, really tricky and out of hand. It's an interesting point that you've made, Mr. Lahane, about geography, and let me bring in Dr. Om Shrivastav on that as well. Dr. Shrivastav, your view, could the geographical placement of the state also be a factor, or is there weather or climate conditions that also become a factor?
Yes, certainly can. I mean, Dr. Lahane has made a very valid point as to geographical distribution and the impact of not just the geography, but also the humidity, also the distribution, also a number of environmental factors. It's too many to elaborate on a platform here today, but all of them come into play when you are dealing with certain areas that are at this time more affected than other parts. So when we say COVID inappropriate behavior, that is one part, but there is also a pattern that goes through several waves, several environmental factors, several non-environmental factors. All of them come together, and all of them will be reflective of the numbers in a particular point in time. There has been no single wave anywhere in the world that has affected the entire geographical area at the same time. It will go through various phases, some less, some more, and that is going to be reflective in certain periods in time. So I think that geographical areas of distribution and environmental factors, both of them are hugely important, and that we probably are in a process of understanding, learning as to how it was different in the first wave, how it is different now. But it is definitely there. You can't disregard it. You can't ignore it. You can't wish it away. It is there to be studied, understood, and a strategy made out of the information that comes out of this. It's also very important, tossing a term like mutation, it has to be validated by scientific evidence. You have to actually show that the strain that was prevalent in, say, the whole of 2020 is different to the strain that is prevalent now. So mutation, yes, we should consider it very seriously, but that needs to be ratified. That needs to be backed by scientific evidence. So all of that needs to be looked at carefully, whether they are environmental factors, whether there are geographical factors, whether there are scientific, mutant strains that can be proven and then shown that yes, this is the reason why the numbers are suddenly so many, so big. But all of that need to be done in a scientific fashion. Other than that, this is all conjuncture. It cannot be used in scientific platforms, and certainly should not be used irresponsibly. Tanvi.
No, no, I completely understand, Dr. Shrivastav, but can you shed some more light on what extent of research and study is going on? And I'm not just talking about right now. One would assume that this is what across the country we've been doing and tracing various samples, studying various samples since the beginning to see the kind of evolution and the mutants that are there in our country. So, is there still that possibility, or are we saying we've tested it out and we've not found anything and that chapter is closed?
No, so again, look, you may have looked very extensively as in this point in time and not found anything. That does not mean that it is not there or it does not exist. You'll probably just need to keep looking longer and harder until such time you are able to have a scientific explanation as to why this kind of event happened in the last, say, 2 months, 3 months, 6 months, 1 year's time. You need to keep looking. If you look at the natural history of viruses in maybe the last 200 years, it is very rare, very unusual that the minute that you have looked at something like this, you have found the answer. You need to keep looking. That has been the nature of all outbreaks.
Okay.
It is very rare that you will get the answer when you're looking exactly at that time. You will need to keep looking. So I don't think that you can say, I have looked and now that the chapter is closed. If you don't have a scientific explanation for what is happening, you just need to look longer, harder, with more resources to the benefit, so that you are able to get an answer. So I think that we don't know enough, Tanvi. That is the one thing I can say for sure. We don't know enough at this time, and that to actually say that this chapter may be closed because I have looked and I have not found the evidence, that may be premature. It may also be irresponsible because that is not the way scientific evidence works in such outbreaks like this infection, and that you will simply have to.
No, so you're absolutely right, Dr. Shrivastav, which is why I followed up and asked you that question, because sometimes the sense that we get from some of the other responses that we get from various arms of any government makes it sound like that's not even an option, and it's not that at all. And so thank you for elaborating. It's more about the how science and research, especially into this issue, is a constant process and will go on constantly, and at some point we may find, so it cannot be completely ruled out. That's something that I actually wanted our viewers to understand very, very clearly, because while yes, we need to be extremely cautious, we perhaps in Maharashtra, Dr. Salunke, need to be 10 times more cautious in following the norms, 10 times more disciplined than the rest of the country, basis the numbers we are looking at right now, isn't it? Dr. Salunke, that question to you, if you can hear me, is our only solution right now to just be 10 times more careful than rest of the country? Dr. Salunke, I believe you are on mute. You'll have to unmute yourself. Okay, let me take that question across to Rajiv Dasgupta, and then we'll come back to Dr. Salunke by then. Mr. Dasgupta, your view on this?
The point is that the current increase that we see are in a set of states which are far more urban than the rest of the country, one. Second, there's so much of talk about COVID appropriate behavior or COVID inappropriate behavior. And this, at least I have been arguing from day one, as have been many other experts, that we simply haven't invested enough in research and survey on the behavioral aspects, when the mainstay from day one, which is exactly a year from now on, now that we have completed a year, from day one, there has actually been so little investment in understanding the social and behavioral components when that's been the mainstay. The vaccines have come much later. The various modalities of treatment, to the extent that they work, have been unraveled as we have gone on. So let us admit that we simply haven't invested enough in that research, that understanding. We haven't invested enough in risk communication. We haven't invested enough in community engagement. Nevertheless, the increase that we see in Maharashtra today, as well as in some other states, would also be in part a testimony to the fact that they are testing and tracking extremely rigorously. And therefore, this is not to stigmatize any of these states, but to acknowledge that actually a good epidemiological work is being done. However, it is also probably the case that the country as a whole is not going to see the very large surge that we had through the last few months before the decline came in. But there would be ups and downs in various states, and the strategies will have to be local, and the strategies will have to be decided by the local authorities, whether at the district level and at the state level.
Okay, it's an interesting point that you've made, and yes, perhaps a lot more study has to be done on all aspects. We don't know much. We work with what we've got, and so perhaps a lot of times we, end up emphasizing on let's just be careful, or instead of letting our guard down and then realizing that maybe that could have been the reason. Now, I want to go to a bit of a positive trend that we're also witnessing in all of this dark statistics that we're looking at. While yes, Maharashtra yesterday reported over 50% of the entire country's cases. While yes, what's happening in Pune and Mumbai and Thane and Nagpur is extremely concerning right now. What we are also looking at, if we actually compare the number of cases and the deaths in our country, in these places right now versus what we had seen in October, at which point also we were pretty much at the same level in terms of cases. There is some difference, and I want to pull up that graphics for you, where in October, between October 14th to 17th, if you see, the number of cases that we had were 10,500, 10,200, 11,400, 10,200. Those are the levels. But the deaths we were reporting at that point were extremely high. So on one day they were 158, but the rest of the days they were above 300, even crossing 400 on a daily basis, 337, 306, 463. In comparison to that, if you look at the week gone by, and if you see the data from March 5th, 6th, 7th, 8th, where again the daily cases are above, in the range of 10,000 and 11,000, the number of deaths that we are reporting are much lower, 53, 47, 38, 22. What could possibly be the explanation for this? Dr. Lahane, would you want to start off?
I think it is very true that the deaths in the March are, as compared to October, are very less. It means it is I can say 10 times less than that. This is because I think there only what we are saying is it may be some mutation, and for that we are studying in the NCCS Pune and NIV Pune that this virus is mild virus. Secondly, now the people are aware that they are coming very early, and because of that we are able to treat them. But if you compare the also the ICU patients are very less in March than as compared to the October. So the number is increasing, but the ICUs are today also not, I think they are only 50 to 60% patients are there in ICU. So that suggests that this virus, in that the disease is mild and not causing much of the severe illness in the disease. So it requires definitely a research that why this behavior is there in this disease this time.
Well, if I may add, this is actually
Yes, in
not
fact, and I
very
believe
unique.
Dr. Sal.
This is not very unique.
Yes.
This has been the experience in
Okay.
particularly in Western Europe. In the later phases of the epidemic, treatment has got more standardized. The epidemic response has got more standardized, and therefore death rates have lowered. The subtext of this is that lockdown decisions will have to be calibrated against the extent to which health services are being stretched, and lockdown decisions are not therefore to be taken on other criteria. At the other end, you have the Brazil situation where, on account of the P1 variant, anything between 90 to 100% of the ICU capacity is saturated in all the state capitals in Brazil. And what we just heard, it actually shows that the ICU occupancy is currently at one of its lowest in Maharashtra. And therefore, those are the issues which should inform lockdown decisions, and not just because the number of cases are rising.
Yes, yes. I
Okay, no,
think
so,
it is.
but let me ask you a follow-up to that before I bring in Dr. Salunke also in it. But Rajiv Dasgupta, what you're saying is what is being observed in some other parts of the world as well about the treatment and how we perhaps know better, and the treatment process is more streamlined and efficient. But we're not even getting those many cases which need hospitalization or which would need ICU beds or oxygen beds. I mean, I'm just looking at the statistics for Maharashtra right now. I'm afraid we've not done an exhaustive research yet on a national basis. But if you look at that, even the need for these beds is far lower this time around.
Well, that's a more granular clinical epidemiology analysis. I'm just commenting on the broad observations, and therefore I again emphasize the state and the local authorities have to be very, very clear on what is going to inform lockdown decisions, because lockdown is something that seems to be on the top of the response, whether it's the political decision making processes or the executive decision making processes. So what should inform lockdown? Because today's breaking news is actually the lockdown in Nagpur. It's to be seen in that context.
Mm-hmm. Okay, fair enough. I got your point. Dr. Salunke, would you want to weigh in on this, on the fact that while we are seeing more cases, there are fewer hospitalizations, fewer deaths, and what should we make out of that?
Yeah, as a matter of fact, I think I would like to go back slightly. What is happening in Maharashtra at this juncture is not something unexpected. This was which we were anticipating when there was a decline. As a matter of fact, in a pandemic situation of viral nature, the ups and downs or the second, third wave is a natural phenomenon, nothing great about that. So what is happening in Maharashtra is likely to happen in other states also eventually. So that particular point needs to be taken very, very seriously by everyone. This is one. Number two, not only the COVID inappropriate behavior on the part of the people in general, but the fact that people started feeling as if this particular virus has vanished from Maharashtra, and then, whether the Gram Panchayat elections, whether the marriages, everyone was thinking as if we are out of the woods. And that is one of the major reasons why we are facing the music right now. As a matter of fact, I'm not very surprised that, when it started from Nagpur, went to Amravati, Vidarbha region, and now rest of the Maharashtra is also having similar problems. Now, the point which is being made, that it is very clear, and please note, we are going to have an increased number of cases in next few days. Those who are in incubation period, they are going to come out either as symptomatic, asymptomatic, or mild symptomatic. So please note, in next few days, we expect rise in further rise in number of cases in Maharashtra, and districts which are comparatively showing less number may also show increased number, because the inter-district communication is still on. That is going to definitely help to increase the number of cases. But let us also appreciate that the virulence appears to be low. Whatever central institutions, whether NIV and others, are indicating that there is no mutation, that's what informally we are being told. But I am of a firm opinion that as viruses go on changing, there is a possibility that transmission capacity of the present version of the virus is definitely more. One, number of cases. Two, we were not finding entire families getting affected in earlier episode, but now we are finding the families after families are getting affected. Two, we are also finding that those areas which were congested and were highly affected earlier are being spared, while the areas which were not affected to that extent earlier are getting affected, which is also a kind of an expected behavior of the pandemic. And the last point that I'm trying to say, at this juncture, it is Maharashtra and compared to rest of the country, is the only state in the country having 50% plus cases must be given additional resources in the form of vaccination by Government of India. I'm very keen and I insist on Government of India that do not sit on the vaccine release. If you want Maharashtra to fight this battle, in addition to the standard operative procedures which are now known to even our tahsildars, even known to our block medical officers, so we don't have to tell something, because there is nothing new that Government of India or experts from Government of India or international experts can say. It is already known, the strategies are known.
No, but Dr. Salunke, I understand that you're saying in terms of the center, giving more allocation, but what's stopping them? Have we made the request? Are we ready with those many more centers? Have we added the centers where we don't have doses? The central government says you can open your hospitals 24/7, your centers 24/7. But are private hospitals really ready to do that? Which hospital is going to be running 24/7 to give vaccination? I am yet to see one example.
I am giving you a concrete example of Pune city. In Pune city, some of the private hospitals have shown great willingness. NGOs are ready to take this responsibility. Tanvi, what is this vaccine injection? What is so great about it? This is a vaccine which needs to be injected intramuscularly, like you give the tetanus tox. So once you are cleared at the central level, once we have a mechanism, only one thing that I'm going to support Government of India very vehemently, and that is the registration of each and every recipient through the app that has been developed is very critical. So follow-up and monitoring, these are the two important things that Government of India insists and which are fully endorsed. But now please note that every private hospital which has ICU facility, every of our primary health center even, where we can manage the adverse event and where we can train our staff. What is so great about it? Why do you want to only block and say that 45 plus comorbidity? Let me ask you a simple question. If a 30-year-old man having severe diabetes, why do you say, no, you won't get vaccine? What is this? Why are you denying that person an opportunity to save himself? I can't understand this. Why can't Government of India release?
Okay, maybe Dr. Salunke, we'll pick that issue up another day for a conversation. If I can just bring back, the focus to what's happening in Maharashtra right now. I take your point of saying, okay, let's step up on vaccination. I think even the central government today has made it very clear that the places, areas, districts, states which are seeing a rise in case, whether it's Punjab or Madhya Pradesh or even parts of NCR now, which have begun to show this trend, you need to step up on vaccination, and so that should be it. But let's go back to the point that was also being made earlier, which is about lockdown as a response. Dr. Lahane, what's your view? Is that really an appropriate response? Is that a proportional response to what we are looking at today?
Lockdown, I think whenever we are considering the lockdown, it should be a last resource. Till that time, we are not thinking of the lockdown, and lockdown is not just number of the cases. But like as the very well Das Gupta sir has said, that it should be on the number of the cases, then the number of the mortality, how many cases are in ICU. There's so many things we'll have to understand to go for the lockdown. So I think lockdown for few days, it is just to understand the people, and again I think they should know that we'll have to go for the COVID appropriate behavior. So that is a must thing, and because as the number is increasing here, I think they must impose discipline for themselves. And so I think I am responsible. This new theme Honorable CM sir has given, that I am responsible. So unless and until, like this Alanke sir has told, that families are getting infected, and so the crowding, then marriages, all these things should be avoided. And because of that, this night curfew and few things to understand the this public that they should behave properly so that they will not get the disease. But lockdown, I don't think this is required today, and we will observe for a few days. And if the number is increasing, then lastly, to save the all people, we will have to go for the lockdown, but not as on today at all, and not on the number of the cases, but number of the fatality that we will have to see.
So what else gets factored into that decision, Dr. Shrivastav? And I hate to ask this question, but that is what is on top of everybody's mind. Will the lockdown get announced today or tomorrow? It's now been done in Nagpur for 1 week, which is a big step and obviously a very, very strong message that is being sent across. And many people in other urban areas like Pune and Mumbai are wondering if they're going to be next.
Well, that is the question on everybody's mind, isn't it, Tanvi, as to whether Mumbai or Pune is going to be next. I think this is something that we are all in agreement. What are you going to achieve by the lockdown? Is it going to be simply that you're making a point, or you're going to be saving the effort on the burden on public hospitals or private hospitals? Whether all these people who are going to be saved from the lockdown, from passing on the infection to others, whether they can be managed at home or will need to go to intensive care units of, what resources are available. I think that, we probably, as Dr. Dasgupta just mentioned, I think we probably need to communicate this more vehemently, more aggressively, that please do not explore this option and please be more responsible as a community. And failing everything else, well, for the good of the entire community, the state, if that is what needs to be done, then that is what needs to be done. So hopefully that stage will not come upon us. Hopefully that the numbers will stay. Maybe even if the number of people infected are going to climb, the case fatality rate, the people requiring intensive care or even hospitalization, why only intensive care, that number will stay under control. Certainly the number of people that I am seeing who can be managed at home without being hospitalized are quite abundant. They are quite a large number, but they are responding quite adequately to conservative treatment in their own homes. And entire families of 7, 8, 9, 10 people are infected, but not even one of them are requiring to go to ICU or requiring a ventilator. So that is a pleasant outcome, I think, in this wave of COVID. That is a good outcome. I hope it stays that way. And that once we are going to be taking more responsible behavior, once we are making people more aware that this is how COVID should be managed, people should be encouraged to come and see their doctors or their hospitals or even the primary health centers. If that state goes into the next level, then hopefully this particular time event of COVID, the second wave or third wave, whatever we are going to call it, once the state comes into a stage of being more in control, hopefully that's all that's going to be required. But that is something we are going to know only in the next maybe week, 10 days, fortnight, depending upon how long this wave stays in the midst of the community. Tanvi.
So in fact, what you've said and what Dr. Saluke was also referring to earlier, let me take it across to Rajiv Dasgupta. So Dasgupta, is what is happening in Maharashtra a lesson and a warning for rest of the country as well, that you're next, or this could be the story elsewhere? Or are we seeing more cases being reported here, especially in the urban areas, also because of higher testing? The cases may not be as intense, the infection may not be as serious and intense as we used to see earlier, which is why there's no need for hospitalization, but there are more being detected because there's higher testing here.
To agree with Dr. Salunke, yes, these are going to be expected. Just because the cases come down doesn't really mean that the disease is eliminated or the epidemic is over. Nothing of that kind. And we have constantly been saying and agreeing that we will live with the disease, and this is what is living with the disease. However, the question is that the extent, and going by the center's position today, that the vaccination needs to be accelerated because it is also an important pillar in addition to the behavioral interventions. The point is that in terms of persons immunized per million population, Maharashtra actually ranks fifth now. There is scope for improvement of that particular aspect as far as Maharashtra goes. I agree with Dr. Salunke that states which are more affected certainly needs to do the vaccination differently. As far as 24/7 centers are concerned, Gurugram has decided today to have at least 5 hospitals. Remember, these urban centers, whether it's Gurugram, whether it's Pune, Mumbai, and so on, these have plenty of high-end, sophisticated, extremely capable private institutions. But at the same time, and this is something a state like Maharashtra with a very sensitive health services should look at, there is enough emerging evidence that the vaccination patterns are following class and digital divides. And therefore, if this class and digital divide continues, in other words, what we are witnessing now, the enthusiasm that we are witnessing now is to a large extent an urban middle class empowered class phenomenon. If this continues, then there are going to remain pockets of vulnerability of those, the information have nots, if I may, who are actually going to remain under immunized, and therefore those pockets would be susceptible to future outbreaks, even if focal in nature. That's something urbanized states need to remember, to actually explore, to be able to close these divides as much as possible. There are gender divides. In fact, now the data is available. Maharashtra is again one state which initially had more women per unit population immunized, but now that's slightly fallen below males. So these are much finer aspects of vaccination going beyond these absolute numbers of so many lakhs and so many crores. That's actually going to shape things in the weeks or months to come.
Okay, thank you so much for elaborating on that and really sharing that insight. And I'm afraid we've run out of time as far as the first half of our conversation is concerned.